Today, we're tackling a critical issue impacting young people in Mississippi and Louisiana, the fentanyl crisis. Fentanyl, a synthetic opioid, is 50 to 100 times stronger than morphine, making it incredibly dangerous. This potent drug is a major contributor to overdose deaths across the U.S., including deeply affecting our communities in Mississippi and Louisiana. In Mississippi, 2018 saw the seizure of 833 grams of fentanyl powder, enough for over 416,000 lethal doses. This amount could potentially kill nearly 14% of the state's 2017 population, highlighting the immense threat. While Mississippi saw a decrease to 220 fentanyl-involved deaths in 2022 from 280 in 2021, the crisis remains a serious concern. Louisiana experienced a staggering 606% surge in synthetic opioid deaths from 2018 to 2022, rising from 201 to 1,216 fatalities. By 2022, fentanyl was present in 86% of all opioid deaths in Louisiana, and in 2023, there were 1,130 opioid-involved deaths. The opioid crisis in Mississippi began in the late 1990s with prescription opioids, but today, synthetic opioids like fentanyl are the primary driver. Nationally, the U.S. overdose death rate peaked in 2022, and while provisional data suggests a potential decrease in 2023, it remains alarmingly high. Overdose rates are still rising among Black, Hispanic, and multiracial populations, highlighting critical disparities. Accidental drug overdose is now a leading cause of death for people under 45, with over 1 million lives lost since 1999. For young people, counterfeit pills pose a significant and often hidden risk. Fentanyl is frequently disguised in fake pills that look exactly like common prescription drugs such as oxycodone, Vicodin, Percocet, Xanax, and Adderall. The Oklahoma example tragically illustrates this, with fentanyl overdose deaths rising nearly 15-fold from 2019 to 2023. Many teenagers are unaware of how dangerous experimenting with pills has become due to the rise of these counterfeit tablets. While adults aged 35 to 44 accounted for 28% of fentanyl deaths in 2023, the rate of drug use among people over 40 is increasing faster than younger age groups. Black Americans face disproportionately high fentanyl overdose rates, and drug overdose death rates are generally higher among males. The crisis is also significantly worse in rural areas due to socioeconomic factors and limited healthcare access. Increased distribution of naloxone is crucial. Mississippi's EMS administered it 2,555 times in 2022 to reverse opioid overdoses. Harm reduction strategies, including fentanyl test strips and safe-use kits, are essential in preventing deaths. Expanding access to medication-assisted treatment and recovery support services is also vital for long-term solutions. Educating young people about the risks of fentanyl and counterfeit pills is key to preventing accidental overdoses. Parents and caregivers should keep medications in locked cabinets and dispose of unused prescriptions properly. The crisis has evolved from prescription opioids to heroin, and since 2013, synthetic opioids like fentanyl have dominated. Fentanyl's low production cost and high potency make it a profitable but incredibly dangerous drug for dealers. Addressing this crisis requires a multifaceted approach, including increased access to treatment and prevention services. Criminal justice reform and harm reduction strategies are also crucial components of this comprehensive effort. Integration of substance use disorder treatment with HIV prevention and co-location of services are needed to curb rising HIV and hepatitis rates. By understanding the facts and supporting these initiatives, we can work together to protect our youth and communities from the devastating impact of fentanyl.